to introduce to you Michelle Hampton, who is actually director of our Doctor of Nurse Practice program, and this is I guess this is the first time you've done a workshop on writing.
On writing, yes.
On writing, okay. So she's going to be giving the workshop today, and I think then it will evolve into some smaller workshops on various aspects of writing. But welcome. And I also would like to introduce to you Catherine Ward. Catherine is our assistant
director of student services, but title aside, I'm writing services and career services support for you. So don't hesitate to email me or come by the office. I'm right next to Craig in the admission office suite. You know where I am.
Yes.
I'm sure everyone else. And just drop in or email me for me to review anything you want, talk about strategies, things like that.
Yeah, she's put together a really good webpage for writing too, some great resources, in addition to what Michelle will share with you. And we're going to try to see if we can link maybe this workshop and future workshops to that writing webpage. So thank you so much.
Well, welcome everybody. I'm Michelle Hampton, as Diane said. I've been the DNP Program Director since last year, but I've been at Samuel Merritt for 10 years now in the coming May. So I've taught in ABSN, ELMS program, BSN. So writing is something that's been a part of pretty much every course I've taught, and I've found that a lot of students have some difficulty transitioning from creative writing to scientific writing, which is something I went through myself in my own studies, and just really ended up learning through trial and error, and sometimes getting some comments that made me cry on papers, and then just kind of building on that as time went along. So I'm kind of interested in what programs you're all in. So can we just go around the room quickly and tell me your name and what program you're in?
Brian Marchese, ABSN.
We're all ABSN. Sorry, that's Corinne Perry. ABSN, 2015.
Megan Brand Pemberthy, ABSN.
Amanda Morley, same. Graham Hart, BSN.
Brianna Graham, BSN.
Lucila Chavez, BSN.
I'm Bobby Ingham with DPN.
Desiree DPM, Charlotte DPM,
Laura, DPM. Thank you, and I think I know this lady. You ready to introduce yourself?
Kat, I'm at FNP and DNP Program Director.
Well, welcome everybody. I'm glad to have you. So before I get into my slides, how about we just kind of toss around some ideas. What's been your perception of the difference between creative and scientific writing?
Scientific is more concise and focused.
So concise and focused.
Backed up by research.
Backed up by research. That's good. That's a good start. So I looked around for a few quotes to start us out, and I really like this one. It says, writing a novel is like driving a car at night. You can only see as far as your headlights, but you can make the whole trip that way. And I thought that really brought to light the point that not only is it okay to not know where you're going, it actually makes it more fun to read creative writing in that way. Alternatively, scientific writing, usually fun isn't even part of the equation, unfortunately. But what's most important is that there are expectations about what information you're going to find in a scientific paper and where you're going to find it. So you have these prescribed headings, and there are certain things that are expected to be in each part of an article. There's a formula. So the basic formula when you're reading an article follows this format. There's an introduction, a method section, results, discussion, and conclusions. So in the beginning, you've got your introduction, and it's going to answer a few questions. What is the problem? What's known about that problem? What's unknown? And what is the purpose of this paper or this research study? So the problem's going to go into the definition and the extent of the problem. What's a healthcare problem that we've talked about a lot? Health disparities. Let's think of one in particular. Okay, so let's say it's in a particular care setting, like one of our faculty, she did her dissertation on disparities in transplants. So who gets a transplant versus doesn't. So our problem would be health disparities in transplantation. So she would have defined that and talked about the extent of that problem. You know, how prevalent is it in the United States or around the world? Then what's known about the problem? What are some topics that might come up in the introduction of that article that pertain to those health disparities?
With regard to transplant, you mean?
Yeah,
What?
or disparities in general.
Who would get them and who wouldn't?
And you brought up socioeconomic status. there's
Age.
Access to care.
Access to care, that might be another heading.
Age.
Age, maybe there are discrepancies regarding that. So all of those might have subheadings in that introduction piece of the article. How it's been studied, how it's been, if it's a health issue or condition, how it's been treated or managed. And so all of that information is going to be supported with research data. Then we get to the piece about what's unknown, and that's called the gap in knowledge. You aren't necessarily going to see them identify gap, the word gap in a paper, but they're going to say, this is what's missing from all of this literature that we've just covered. And ideally, the gap is going to directly relate to the purpose. So if in our health disparities with regard to transplant article, we say that it's unknown the disparities for Native Americans in transplantation, then our purpose is going to say that we want to explore the rates of transplantation for people of Native American descent versus whites or other ethnic groups. So sometimes this is going to be stated as a hypothesis or a research question, but generally we're going to look at something that meets all the criteria for PICO. Do we all know what PICO is? What's the P?
Personal population.
Population, the I,
Intervention.
the intervention. That's right. C, comparison. So it might be a control group or a comparison condition like before or after. And then the O, the outcome. The outcome is going to be did they get the transplant or not. That's what we expect to see in the research question. Then the method section of the paper is going to answer the following questions. What was done to achieve the stated outcome or the purpose of the paper? So we're going to look at the sample. Do we have a sample that has Native Americans and enough people in other groups to be able to have a representative study? Did they describe the procedures, the data that were collected, and how were the data analyzed? The results section is going to look at how the data was analyzed and give you those results specifically. So you'll see descriptives of the study, what were the characteristics of the population, and then the things that answer the research question specifically. Then in the discussion, the questions being answered are how were the results of the statistical analysis interpreted? How do those results compare to similar studies or studies that pertain to the same topic area? And then how do the authors report the limitations of the study, and how then can we interpret those results in light of those limitations? Then finally, the purpose of the conclusion is to say what the results mean in terms of next steps for research and what are the practice implications. So now that having a good idea of what the formula is for an article, you can apply that to your work as well. It might not follow the exact format of the research study, but the introduction section is going to be the same. If you're doing some sort of a lit review, you're going to talk about the purpose of your lit review in a similar way. So from my experience as a student and the work with my students in the courses that I've taught, I've compiled a list of some of the most common errors that I see in papers that have been submitted. So they're summarized here in the next 2 slides, and then I've got samples in the following slides. And then I finish off the presentation with an approach to writing that I've developed through a lot of trial and error. So if you don't have one of your own, you can borrow mine until you figure it out. So the first issue that comes up is, what can you say without citing? So on the left side, I've got something similar to what I see in the introduction part of many papers that students turn in. And I'll read it out. Many individuals with mental illness are suffering from substance use disorders as well. Unfortunately, there are no easy solutions to this problem. A patient with both a mental illness and substance use disorder has a long and tumultuous treatment road ahead. It's unacceptable that this lack of treatment continues, and something must be done immediately. What is the problem with this?
Very opinionated. Too biased.
It's biased, but suppose some of this is true.
Still biased.
There's no way to know.
There's no way to know because
There's
there's no sources. So how long do you feel like it's okay to go on without citing something?
You can do that.
Well, actually, in an introduction, in a paper, there's very little that you should be saying without support from data. So the statement that I have on the right, the first sentence is a transition into the paper, then it's followed by a statement that gives specific data from 2 studies, Dixon and Levin and Hennessy, and then it's followed by another transitional phrase which leads into the next paragraph that starts talking about negative outcomes associated with substance use. So I remember when I was in school, the joke was that if somebody else hasn't said it first, you really can't say it in your paper.
On the one on the left, when you're saying the first sentence, wouldn't you technically have to cite that? Like, why you're saying many individuals with mental illness suffering from substance use disorder as well, wouldn't you technically just say?
Well, not only that, but you'd want to be more specific. Many is kind of meaningless
Right.
in a scientific paper, so there's a ton of problems in there. We're just on the part about citing so far, so we'll get to all the others too. So the second error that I thought we'd discuss is the primary versus the secondary source. This can be, take some learning, and I didn't really understand it when I first started in school, so I thought I'd include it as well. So I've got a snippet from the introduction of a paper that I wrote and the results section of a paper that I wrote. Part of it is from the previous slide too, and I added the results piece. So if you wanted to use information from this paper, what would be appropriate to source using my reference, Hampton, Chaffetz, and Portillo? Either 50 to 60% of adults with SMI have both mental and substance use disorders, or B, the rates of infection for HIV and HCV were 6% and 15% respectively. If we were going to tag Hampton, Chaffetz, and Portillo to the end of either one of those statements, which would be appropriate? B. What's the problem with the first one?
It's someone else's finding.
Right, so if I were to try to plug the A into my paper or someone else's paper, that would be considered a secondary source. So if you wanted to use that information, maybe that would be valuable to your paper, what would you need to do? Yeah, you'd have to go dig up the Dixon and the Levin and Hennessy papers so that you could cite them as primary sources. The second piece, the B from the results section, is what you can cite. That's the data that was generated from that paper, from that study. So you've got an idea of what's appropriate to cite, then how do you cite it? So this is, again, the same piece from the results section I just showed in the previous slide. So if you wanted to cite this result, even though both could be appropriate, what's the preferred way? the direct quotation, 15 reported a diagnosis of HIV and 38 reported HCV only, or B, the rates of infection for HIV and HCV were 16 and 15% respectively. How many for A? Show of hands. How many for B? So more for B, that's the correct way. So paraphrasing is the standard and what's expected most of the time, unless you've got something that's stated so profoundly, you wouldn't want to alter how it was phrased. Otherwise, you would paraphrase. And it's usually more concise as well. So plagiarism is another topic that comes up, and often when I've had students that have done this, it's been inadvertent. So I've tried to work on ways to help people to understand what plagiarism is, and then once you know clearly, it's easier to avoid it. So again, we've got our results section that we've been using in the last couple of slides. So which of these two is considered plagiarism? A, 64 subjects reported HIV and HCV diagnoses, and the rest were disease-free or did not know they were infected with the citation. And B, 25% of adults with severe mental illness have diagnoses of HIV or HCV. That's the plagiarized one. How about A? It's cited. Anything else you noticed about A? It's very close
It's very close,
to the wording of the original sentence. So it would be considered plagiarism even though the citation is in there because there are no quotation marks. If you're going to cite something that closely to the source, you might as well just put it in quotation marks. So you need to do the work to do the paraphrasing. A and B are plagiarized.
They both are.
If you're just changing 2 or 3 words, then it's not sufficient.
Why would B be a plagiarism? I mean,
The citation isn't there.
oh, the citation's
It's paraphrased pretty
It's
concisely.
paraphrased pretty good.
Yeah, it's paraphrased pretty concisely. So, on to other citation issues. How do you deal with having multiple studies on the same issue? So, single versus multiple study citation. So on the left side, I've got a sample of a passage. It's the same intro again, but instead of combining the Dixon and Levin and Tennessee articles, I separated them out. But when you look at it, it's pretty close, saying pretty close to the same thing. So 50% of people had both mental and substance use disorders in the Dixon article and 60% in Levin and Tennessee. And there's no need to use 2 sentences for that when they're saying essentially the same thing. So it can help to make your paper a little more concise to put them into the same sentence, and I did that by putting 50 to 60% and citing both. So I see that even in later parts of the paper where students will discuss one article at a time and taking one piece of it. You know, this was how many people were in the study. These were the methods used in the study. These were the results. This is the critique of the study. And if you can combine aspects of various studies into the same paragraph, it's really better for the synthesis of the paper and having it flow a little better. So if you've got a long passage from the same source, another problem that I see come up is that students aren't quite sure where to cite or how often to cite. The general rule that I've used is to, if I have more than 2 to 3 sentences on the same source, I'll cite once at the end of the first sentence and then cite at the end of that passage as well. So it's clear that all of this is coming from the same source. Another challenge that some students have had is how to distinguish summary of an article versus a critique of an article. So looking at the left and the right, which would you say is the summary and which would you say is the critique? The critique is on the left. And what about that makes it a critique?
It takes the time to point out any potential errors in the study for the article. After it's published.
Yeah, so it's looking at some of the limitations of the study and interpreting how that might have affected the results. And the other one, it just kind of tells you the details of the study. So if your faculty member is asking for a critique, make sure you're looking at not only maybe a particular study, seeing what were the limits of that study and how it affected the results, but also you can look at gaps in the literature overall, or what's the critique of the literature overall, what's missing. Like when I did this study, one of the things that I found missing in the literature was that while there are a few studies about HIV prevention in people with substance use and mental illness, they're all focused on sexual risk prevention, and there's nothing for substance-related risk, even though there's so much substance use in the mentally ill population. So that was my critique for the body of literature overall. And then another thing to keep in mind is when you're writing your critique of a study, you don't have to talk about absolutely every aspect of the article, just the ones that are most pertinent for that particular critique. So when I was talking about the self-report data in this one, I didn't need to talk about the sample size because it was a pretty decent sample size. It was over 250. I didn't need to talk about other types of data collection because the rest of that was more objective. Acronyms. I call it overuse here, but you can also think of it as acronym abuse because sometimes when you see a paper, you get up to so many acronyms that you completely lose track of what's being talked about. So here I've got 4 acronyms, which I realized that I committed my own error when I wrote this paper because I had 4, but usually I try to limit it to no more than 3. Since I was talking about HIV and hepatitis C virus in this one, I was kind of stuck with doing 3, but usually I will limit it to as much as possible. If it's not your most frequently used term, just spell it out. So your most important task is to make sure the reader can follow you.
This might seem a bit kind of out there. When you're writing a scientific paper, do professors prefer people first language, or is this something that isn't considered quite as important?
I think it's important. A faculty member could vary between them, so if they ask for it, you definitely want to put it in there. Each faculty should give you some clear guidelines about what to expect in the paper, and that's the most important resource to use when you're developing a paper. So another challenge that I found with my students, I teach a research course, so independent versus dependent variables can be a little tricky. So can you guys define for me what's the dependent variable? Yeah, it's the outcome that's being measured, and then, so the independent variable is what? It could be what's being changed or what we are thinking could influence that outcome. So some studies are definitely implementing a treatment and looking at how that affects the outcome, but sometimes it's more descriptive, like my study was, and I just looked at these pre-existing conditions to see how they influence the outcome. So this particular results table, it doesn't show the outcome variable, but it's comparing the people who had HIV or hepatitis C virus to those who didn't, and giving the odds ratios for those. So then the next set of terms that sometimes gets confused are outcomes or hypotheses. What's a hypothesis?
What you're trying to do with the paper.
So it's often thought a direction associated with it. So if you, say I had later gone on to develop a study that looked at developing and testing in HIV prevention intervention in this population. So I would want to see that there were fewer risk behaviors after the intervention was completed than before. So my hypothesis is that after this intervention, risk behaviors will decrease. Whereas my outcomes are just the things being measured. How many, or it would be the behavior, sexual or substance-related risk. And in this example, HIV infection or HCV infection. So often the students will say their outcomes are the subjects with injection drug use histories will have more, or will be more likely to have HIV and HCV infections, rather than just saying it's these two outcomes that are being measured. Operational definitions are another thing that sometimes students can have difficulty with. So what is an operational definition?
Something used for the purpose of the paper
To
inform the audience what you're working on.
So what this outcome means. So if race and HIV infection are two outcomes or variables I'm using in the study, I have to define what that means, because one study could say that race is observed. I've seen that in some older studies. Another study might say that race is what the subject reports. So the author has to define what these are. So self-reported racial identification might be a way of identifying race, and then HIV infection in the study that I just did used diagnostic records, but the patients reported their diagnoses by self-report. Another study might say that it was confirmed with serological tests. And now that's important to know when you're determining how to interpret the results. So what we talked about earlier, vague and exaggerated statements. This is our time to talk about that now. So using a lot of adjectives or ones that have a lot of opinion placed in them usually don't have a place in a scientific paper. So the left is vague and exaggerated, and then on the right is the more specific statement. Just try to stick with the evidence that you have before you, and don't use a lot of adjectives unnecessarily. Any sentence that you have should convey specific information and should be, if not a direct piece of information from a research study, at least linked to that in some way or a transitional phrase. The only places where you won't see citations a great deal are the results section and the conclusions. That's where the author can really just use their own words. Another thing to be careful of is varying the terms that you're using. So in my paper I used severe mental illness, I made it an acronym. So I don't want to go later in the paper and then use severe and persistent mental illness or mental illness by itself or mental disorders or start naming specific disorders, because I've already defined what I mean by SMI. So just keep that in mind when you're going through your papers, and you might do one last read through at the end of your paper and make sure that you haven't done that. And usually you can catch it. So for anybody who's ever had trouble getting started in writing a paper, I've got some ideas for how to get started and break it into manageable chunks. I remember when I was working on my dissertation, I had this huge piece of poster paper, and every time I would start feeling overwhelmed, I would just start making smaller tasks out of the bigger ones. So here's my approach to writing, and it could be helpful for you as well. So I'll reserve a day just for searching. I don't try to do anything with the information that I've searched. It can be really overwhelming just to do the search, even when you know how to do it. Barbara Reichen's here and can speak to the value of learning how to do a good search. We have wonderful librarians here, so if you've never really learned how to do a thorough search, I would suggest making an appointment. I don't know, do you guys have courses in how to do search?
we do come into some classes and talk about searching. And on the website, we have tutorials about the different databases and how to search them. But our advice is to don't spend more than half an hour struggling with this search. Don't spend as much time that you're like frustrated and angry. Make an appointment or drop in and we'll help you, okay? So sometimes it's just a matter of a suggestion of a word or two and then you're on your own, okay? So don't hesitate to call. Yeah.
Are you coming downstairs after this to do our research class? We're doing search.
I'm not, but
We're doing
Debbie Summer and High Chunk Soda
Okay.
will be teaching that.
Ah, okay.
So, and so those are the two main the three of us are the people that you go to for help.
So some of the great things that they can help you with are determining your search terms. I put a couple of screenshots up here, and what that red arrow at the top is pointing to on the PubMed page is the mesh database. I don't often do my searching in the mesh database, but I do use it to find the terms that I want to use for my search. And usually combining 2 or 3 of those should help you to have a narrow search. The limits that you choose on any database would be age, ranges, language for the articles, the type of studies you want to look at, RCTs or descriptive studies, review studies if you're looking for something in particular. And then deciding what databases you want to use. The bottom screenshot is the library's webpage where you can find a really extensive list of databases. So PubMed's a frequent one that we use. CINAHL is one that we use a lot in nursing, but because my area of interest has to do with mental health, I also use databases like PsycInfo or PsycArticles. So identifying the studies I want to find is one piece, and then storing those results. So you might want to store it in a file. I think you can store it on something like RefWorks or EndNote.
And in CINAHL and PubMed, you can also create an account and keep them there permanently and run the searches over again.
And it's setting up alerts so that it will send you those additional articles every time they come up. So if you're working on a doctoral program, this is really great that they can just send you those and you don't have to recreate the search every time. So this would be one day or a couple of days. I wouldn't try to do anything else when I'm working on that. Then the next step would be to retrieve those articles. So I've identified what I want to use, and then I'm kind of old-fashioned and I will actually print my search list, and then I highlight the ones that I want to get if I haven't deleted them from the list. You can also save these to folders. I will print the studies that are accessible on the website and then place interlibrary loan requests as needed. This is a great service if you've never used it before. It's fairly cheap here because it's a couple of dollars. It's free for students as well. Great. So any article that's not there, it's possible that the library might be able to get it for you. Then create a reading schedule that's realistic and works with your other responsibilities. I can usually get through about 4 articles a day. I used to be able to do 6 maybe when I was younger, but my brain just doesn't work that long anymore. So I'll just schedule days where I can get about 4 in every day. And then I go on to my next step, and sticking to my schedule, I fit those reading days into my calendar, and then commit and stick to your reading schedule, which involves reading those papers that you said you were going to read on those days, making notes and comments in the margins, and highlighting the things that are important. The point of this is to avoid having to reread the article when you need to retrieve that information. So you can do it if you've printed it out, or you can also do it in Adobe as well. Highlight and make your comments on there as well. Then after you've got your reading done, or you might want to make pit stops along the way in documenting the information or tabulating the information you get from those papers. But this is a sample of a table that I use for a paper that I wrote. So those comments that you've got from your papers, take them and start putting them into this table. You at the least in your table want to have the investigators' names, the year of the study, the number of participants in the study, the design, and the significant outcomes. I also usually include an other column, just in case there are things that come up that I haven't planned for or didn't expect to find, and I can add those. And in this particular table, the inpatient or outpatient column is something that I added later because I started realizing that the results differed based on that. So just always keep in mind that you might want to add something to your table. So you can do this every few studies, you can do it all at the end. As long as you've made those notes in your margins and highlighted the things that are important, it shouldn't matter when you go back because what you need from it is already there. So just to recall what is okay to cite from a study, which section would be? Can we cite anything from the introduction? No. How about the results? Yes.
Yes.
The results section of research paper is what we can say. So once you've got everything in your table, you can start studying your table to see what sort of themes emerge from each of the articles. So in this particular one, I highlighted some of the themes that I found for this paper. So this was a paper about disparities in mental health care for people with, who are African American with mental illness. So the yellow pieces highlighted symptom disparities. The blue statement was treatment disparities, and the green were diagnosis disparities. So I had probably 100 or so references, and I looked at that and categorized them for all of those different symptoms. So when I was making my outline, which I believe is the next bit, I made each of those categories part of my introduction subheadings. So you see symptom disparities there, diagnostic disparities, and treatment disparities. And then you can plug in what you want to say under each of those topics, the exact information that you got from your table, and who said it. Again, this will keep you from having to go back and forth a lot. But one thing you want to do is you want to make sure that you've decided and been consistent about, are you going to paraphrase from the study into your table or from the table into your paper? Pick one and stick with that so you don't have to worry about making errors in terms of plagiarism. So after you've made your outline, you're ready to start writing. So I found that handwriting works best for me in terms of the flow of my thinking. So I continue to do that. I get a legal pad and every time I'm starting a new paper and just start writing. And I don't worry about how it sounds, what my grammar is like. I just try to get the thoughts in that I want to follow that outline. And then I go back and I edit it. I might type in between there and get it in there, and that's kind of a way to decompress. It's just kind of one of those busy work kind of tasks. It's like taking a break. And then you go back and do an edit. And then when you've got a pretty good draft you think you've got going, then go ahead and read it aloud to yourself. You can often catch a lot of awkward phrases by doing that. If your faculty member has set up your paper submission and turn it in, you can take a look at grade mark and the originality report for plagiarism and make any edits that you might need to after you've checked for that. It's also a good idea to get some feedback. If you've got somebody like a mentor, an advisor, a faculty member that you're close to, or even another student who's in your class who can evaluate it using the rubric from the course, that can be really helpful to you. You not only need a little break from your paper, but it's also nice to have a fresh set of eyes look at it. Because once you get in the weeds with your paper, it's hard to take a step back and see what it needs. That's the take a break piece. And then finally, revise and repeat until you're deadline, pretty much. No paper is ready to go on the first submission. So just expect that it's all part of the process to write, edit, revise, get some feedback, revise again. So finally, I just ended with giving you guys a few resources. I have some of these here with me. The APA style guide is something that's on the library's website. That's here if anybody would like to take a look before leaving. And then the Purdue Owl APA style guide is something you can access online. It has a ton of information that's really valuable. I always put it in all my courses so my students can access things. It's easy to find and easy to read. Writing in Science and Medicine is a booklet that I purchased, and I found it's really practical advice. You see I've got all sorts of little tabs here. I couldn't fit a lot of it into this workshop, but I would recommend it if anybody's interested and doesn't mind spending $135. I thought it was
That's
worth
how
it.
much that book costs?
Yes. I think it's really valuable though.
Really?
I'm glad that I got it. Yeah, I wasn't sure when I bought it, but I'm glad that I did. And then the last resource is something that our School of Nursing Dean Audrey Berman has put together called Scholarly Writing in Science. And if you'd like a copy, I can email it to you. She sent it to me for this workshop. So not only does it have APA information, but also just writing style. And it's in pretty easy to digest format. So if anybody wants to look at these, I'll put them on the table here. And then I can take any questions, either about writing or I also said I would take questions about graduate education and nursing as well. So, thank you.